kañ nga gëj a dem lopitaan pour nemmeeku sa wérgu yaram
ndax xam nga sa wérgu yaram fu mu tollu
est-ce que yaa ngi bàyyi xel ci li ngay lekka
wala exercise bokk na ci li ngay sóoraale ci sa dundu pour am ci lu la leer toppaleen ñu leen di bu ne ci suñ programme yi health check nga xam ne lépp lu ñuy waxtaanee dina méngoo ak sa wérgu yaram.
Good afternoon. I am Dr.HASSAN AZADEH. I am a clinical director of medical clinic and also a university professor teaching obstetric and gynecology as a senior lecturer. I have been asked to give some headline of the female breast. The talk today is rather about the female breast cancer. But before we get to the cancer of the breast, let me just give you a picture of a normal breast of a female. The female breast started actually to appear when the female girl is about 8 to 11 years. The female feels something, growing something in the breast area, bit of tenderness, with the pain, is the time of the puberty. When this girl grows to the teenage age, we're talking about between 14 and 16 years of age, the breast has another development. The development of the breast is that the normal breast can get bigger, become a shapes, and also they might eventually get interfere when that young lady is menstruating, that some tenderness, some pain during that time. But it's not the end of it. When that young girl becomes someone who gets pregnant, a pregnant woman breast again make different kind of development. Obviously, while she is pregnant, all the breast glands, they swell and they get a lot of vascularization in those glands, and they get ready for the producing milk for the mother to breastfeed her baby after delivery. Again, it's not the end of the issue of the breast. When the women come about the age of 40 to 50 years of age, there is another development and another changes of the female breast. We call them the period before the menopause, during the menopause, and after the menopause. During that time, the breast of the women gradually shrinks, lose the shapes because of the lack of the very essential hormones, which we call it estrogen, during that time. So, lack of estrogen during menopause, the breast, the shrinks, lose the shapes, and is all part of a natural development and aging of the women. That every woman eventually, and not even eventually, it will come to those kind of ages where the breast and the entire body of the female make some changes. The breast is not always developing by every lump in the breast. We should think of the cancer. No, it's not the case. As I have described, those changes during the entire life of the women, they get some different of changes. There are some lump eventually develop in the breast, which if it's been properly diagnosed, we call them non-cancer. Eventually is the case. The only thing can explain whether it's cancer or non-cancer is to be diagnosed, to be going to the clinic, to be taken scan done, and eventually get some pictures of the breast to see whether that particular lump of any part of the breast is either benign, non-cancer, or eventually developing the cancer. So you ever felt any changes like that, a lump in your breast where before you could not feel it there and now developed, you do not sit and wait and then say and do not ignore it. This is the high time for you to go and get diagnosed. And that is the thing. We, doctors, hospitals, and they are there really to help you. And you will wonder what I'm saying to you now. About 86% of patients eventually come into the clinic and say, I think I have a lump in my breast. This is the women themselves. So 80% of the finding some changes, some lump in the breast, they are the women themselves. We call it, and we recommend, we emphasize that every woman, by taking shower, to do a kind of self-breast examination. I will repeat that. Self-examination of her breast. All what she need to do, just to touch her own breast at different size and different part of both breasts, to feel it, whether there is something extra in one or other breast has developed. You will not miss it. And when I say 86% of women, they diagnose themselves, is the fact and recorded. So that exercise should be taken at least twice a week by a self-breast examination. But if you have any kind of swelling in the breast, and eventually if they come to a kind of infection in the breast, by infection in the breast, the lump you are feeling is painful. It's painful. Become rather in color, get reddish, very sensitive. And if there is, definitely, there is something going on in your breast, and you should not wait, God forbid, that which could be diagnosed, which could be helped, which could be treated, wait until, God forbid, develop a breast cancer. Breast cancer is one of the commonest disease in the Western world. You will not see as many breast cancer in developing country, in Africa in particular, as many as you see in the Western world. One of the main reasons is proven because women in Africa and a part of Asia, when they deliver the baby, they breastfeed that baby. Breastfeeding reduces the danger of eventually developing breast cancer. In Western world, the breastfeeding is not as serious and as often as they should do. But this is now. But if you have anything like that, do not wait. Come forward. We can diagnose it. We can help you. One other thing, and you should think about it, the breast cancer could be inherited. It could be inherited from mother or sister to the member of the family. If you have a mother, if a mother or your sister having history of having breast cancer, this is even more emergency that you go and get checked. We always advise you at least every 2 years to have this mammogram and then scan to find out whether this has been inherited from your mother or from your sister. So having history in the family is another reason you should rush and you get big change. Now, what we do at the moment here at our medical clinic, just to help women in the country, we do a scanning of the women's breast free of charge. It could not be easier for you to contact the clinic, to get the time, to get an appointment, and to come forward, just even if you don't have any kind of symptoms, signs and symptoms of your breast. No lumps, no pain. It's advisable, make use of it. It's free. So you come and do it. And we do this exercise every year. And you would not believe it, after we done about nearly 100 women within few days, at about last year, about 15% of women, they came for this free screening of the breast, they had an issue with the breast. They had some abnormalities. As soon as we see the abnormality, then there is another step to take. We can do a mammogram, and then we can eventually take a sample from that swelling, from that lump, looking under the microscope to see whether the cells who has developed there has increased that in whether they are cancerous or they are normal. If they are normal, it doesn't mean you will say, okay, I'm fine, I don't want any more breast screening. And every woman, in particular, when it's becoming very near to that menopause age, they should, what they do in Western countries, every 2 years they go for breast screening, whether it's a mammogram or eventually is the counseling with a scan. So this program and this clinic urge you actually to know, so to have some information about your breast. They give you advice. If you feel anything, by, as I emphasizing again, by doing your self breast examination. Easy. Keep in your mind, cancer can develop very quickly. But now in the cancer treatment in the world, the breast cancer, if it's been diagnosed early, the treatments are there and the chance to survive is much higher than other type of cancer, which is actually is good news. You feel something, you go, get diagnosed, and eventually is abnormal, being treated, and you get rid of the cancer. So it cannot be easier than this. So please take our advice, come forward, check yourself first before even coming to us, and then we can do like a technical ways of it by scanning, doing a mammogram, and then to prove it, what is growing there, eventually growing there, is cancer or is not cancer. So do not be afraid if you come in for screening, we will find cancer. It's not the case. It's just like any other scanning of the human body. Whatever is normal, we write is normal. If eventually some abnormal, we describe it, taking picture, bringing evidence, that part of your breast is something going on, and eventually you develop something which can be taken. taking care of it, to be treated, and to save your life. I hope this message goes through with our live program at Facebook, at the TV, and anywhere else. And today, you can also read my own publication about the breast cancer in the newspaper, a standard newspaper from today. There is my publication with all the explanation of the not cancer and cancer, and advise what you should do, as I've been trying to emphasize. I'm repeating few very important point just for you to catch. Why we are doing it is your health. Come forward, stay healthy. Do not ignore something and then eventually develop something very dangerous. We always say prevention is better than cure. That is the message we're giving to you by this program, and you are all welcome approaching any clinic, any nurses, any midwife, just to be checked, not only these few days, all along. Every clinic and every hospital, they have their own facilities to check whether your breast is normal. If there is something, immediately will be taken care of. Thank you so much.